Hello, and thank you for listening to our ISTAART PIA Relay podcast series, brought to you by NIHR Dementia Researcher. ISTAART is a professional society and part of the Alzheimer's Association, representing scientists, physicians, and other dementia professionals active in researching and understanding the causes and treatments of Alzheimer's disease and other dementias. In this 5-part series, we've asked members of ISTAART professional interest areas to take turns at interviewing their colleagues and being interviewed themselves. Confused? Don't worry, it'll all become clear as the week progresses. We'll be releasing one of these podcasts every day in the build-up to the Alzheimer's Association International Virtual Conference to showcase the work of ISTAART PIAs. Thank you for listening.
Hello everyone, and thanks for joining us. I am Cécilia Samieri. I am a researcher in epidemiology. I work at the French National Institute for Health, which is called the INSERM, and I chair the Nutrition and Metabolic Disorders PIA. Today I am delighted and very happy to be talking with Dr. Sietske Sikkes. Hello, Sietske. Can I start by asking you maybe to introduce yourself and tell us which PIA you are involved with?
Yes, of course. And congratulations on pronouncing my name so well, because it's the most difficult name ever. It's a typical Dutch name, but you did very, very well. So I'm Sietske. I'm an assistant professor at the Alzheimer Centre Amsterdam of the Amsterdam University Medical Centers and the Department of Clinical Neuropsychology of the VU University. I have a background in clinical neuropsychology and in epidemiology, and I'm involved in 2 PIAs actually. I chair the PIA for the non-pharmacological interventions, and I'm also involved in the PIA for subjective cognitive decline, where I'm the chair-elect.
Great. So I saw you had a very rich background. You moved a little bit for a postdoctoral position in Paris, actually, with people that I know, and then to Boston, to Harvard Medical School. And I saw as well that you were very much interested in cross-cultural differences in terms of neuropsychology. So I was wondering how this very rich experience informed or changed or modified the way you were thinking about cross-cultural differences in your field.
Yeah, that certainly has enriched my experience of how to look at cross-cultural differences. Because in my research project, this was actually my PhD project, where I looked into the measurement of everyday functioning. And during my first, it wasn't my first, but during my first presentation at AIC, I presented the work we had been doing in developing a new measurement tool for everyday functioning. And I was approached by someone from Thailand, who said, oh, can we actually use your instrument? And I thought, well, that's, of course, the everyday activities differ very much from what we see in our population. And ever since, I've been intrigued by cross-cultural differences and how we can apply measurement tools across cultures. So for my postdoctoral fellowship, I went indeed to Paris and to Australia to study cross-cultural differences. And I would have expected to some degree that the difference, for example, with Australia would be much bigger than with France. I thought, well, France is France. But actually I observed that the cross-cultural differences were very big between the Netherlands and France. And I experienced that also because I lived there for a while. And I thought it was very informative also because we started out with doing a translation of our tool. So it's a questionnaire, and we did a simple translation. And then when I arrived with my translation in Paris, people like, I don't understand what it says. And then it turned out that the translator wasn't actually from France, but from Belgium. And there was a lot of Belgian France in the translation. So that was that I thought, it's never as easy as it seems. So ever since, when people talk about a translation, I'm always like, well, beware. There's a lot of more work involved than you think.
That's really great. It's so interesting. Tell us a little bit more about your research, because you have been doing a lot also in intervention, non-pharmacological intervention as well. So I would be interested to know more about that part as well.
Yeah. So I did indeed, to start with the non-pharmacological interventions. That was actually research that I have been doing, specifically focusing on lifestyle and the prevention of Alzheimer's disease, and then for people who experience memory complaints. And we just completed a big project where we looked at specifically at how to inform people about lifestyle and lifestyle changes. Because when we think about lifestyle and prevention of Alzheimer's disease, it isn't a simple solution. It isn't a simple 6-week intervention and then you're done. Then your Alzheimer's risk is gone. It doesn't work like that. At least that's what we assume. And that's obviously your research also, where lies the time window and when do you have to intervene and for how long. But my idea would be that with lifestyle changes, it would be you need to accomplish structural changes. So we focused in this project on how whether people are interested in information about lifestyle and the brain, and how we can present that information. And what I thought the most striking findings were actually that people were very interested in learning about lifestyle and the brain, and but that they also didn't know where to look. So they would just Google information and they would have like the strangest associations that you find on Google, and they were like, yeah, probably these resources are not trustworthy, but I don't really know where to look. And what we also, so that we found that on the one hand, so that's very promising that people want to know about the information and they're looking for that kind of information. But on the other hand, we found that you have to be really, these interventions need to be tailored. They need to be personalized. So if you, because it can also have the opposite effect. If you tell someone who is completely not physical active and you give that person the advice to go for a run, then that's too far out. So that doesn't work and can actually have the opposite effect of not wanting to have to do anything with the intervention at all. So the information needs to be personalized in order to have the effect. And that I think that these were the main findings from that project focusing on prevention.
All right. And the way you are thinking about the finger study applied to your country, or is that a different project?
That's a different project. And actually the Dutch part of the finger study, we're currently in the process of setting that up. And I'm also involved in that study, but this was specifically a study focusing on people who present with memory complaints. So the people with subjective cognitive decline. So I work in the Alzheimer Centre, which is a memory clinic. And there we see about a third of the patients that we see have memory complaints, but their cognitive performance is still completely normal. So and from those people, we really got the question, okay, but what can I do from a lifestyle perspective? So these people we know have a need for information The finger study is, of course, more aimed at the general public. But this was specifically that population from which we know that they have a need for information. And also, yeah, it felt like if you, that you really want to offer them something as a clinician, that you do not want to say, yeah, you have to, you can do healthy lifestyle stuff, but you really would like to give them more concrete advice.
So in France, we have that issue. So clinicians told me that in memory clinics, there are less and less early or prodromal patients. I mean, people go to the clinics really too late. And so it's quite difficult for people to set up, you know, early intervention trial or early trials, because the patients just don't go to the memory clinics. Maybe it's very different in your country because it's very country specific, the way it is organized. But what is your feeling about that?
Yeah. So the trend that we observe is actually that people come earlier and earlier. So that's indeed, it might be a country specific trend.
Maybe the physicians are really well informed in your country and just tell the people to go to the specialty center.
Yeah, so I think that is indeed the case. It's also our national patient organization works a lot on getting people informed. So it could be the case that that's a difference, but I would think that in France you would have the same.
People tell that's not the case. People say that the physicians in France don't really believe that because we have no treatment, they are not really willing to tell people to go to the memory clinics to get a diagnosis. They would tend to say, okay, there is nothing to do. Although we all know that it's not the case, there is a lot to do in prevention, but I mean, it's maybe a cultural thing as well. So it's an issue. I think it's an issue. Of course, La Salpêtrière, where you worked, has a lot of really great memory clinic with early patients.
Yeah.
But generally, I think in the whole country, it's more complicated.
Yeah. Yeah. So it is a general awareness issue of seeking help when it's still, well, according to the recent insights, it's of course, the earlier you are, the better. So it is awareness of being able to do something. And I think that is indeed a shift in awareness that is necessary.
So maybe we can talk a little bit about the PIA now, because it's very important. So how does the work of your PIA support your field? So you're involved in two different PIAs. So what can you tell us about that?
Yeah, so the PIA, I think the PIA really supports actually a lot of the research. So for the non-pharmacological interventions PIA, during the scientific session, but also during the business meeting, I think this was 2 years ago, we had an extensive discussion about what non-pharmacological interventions actually are, because non-pharmacological is just defining something by what it is not. So we had this whole existential crisis of what are non-pharmacological interventions. And based on that discussion, we gathered experts and really asked them about their interventions and to structure their interventions in a similar way, according to a framework. And then we also asked them to give an overview of their field based on really systematic evaluations. And based on that, we together we wrote a position paper, and actually people from the nutrition PIA were involved as well.
Yeah.
And Martha Claire Morris was very involved in setting up the position paper. And we've also, it's currently still under review, but we've decided to dedicate the paper to her memory because she was very active in setting it up. And so this was really a cross-PIA collaboration on really trying to structure the non-pharmacological interventions and to answer the question on what it is and what it characterizes. And I think that is it will be a very important paper. And I think that that is one way in how a discussion in the PIA led to an, I think, important paper. And but another thing is for the non-pharmacological interventions PIA, what we had was we have this specific working group that is focused on methodological quality of non-pharmacological interventions. And that's also something that we found out when trying to characterize the interventions, is that you have a lot of different interventions, but that the quality of the methodological quality differs very much, and it varies, and it's very difficult to evaluate the level of evidence, or to evaluate the evidence when the level of evidence is isn't always comparable. So we have a working group, the CIDR working group, that has focuses on the methodological quality, and that also published the cocktail tool. And that's a website where you can evaluate the level of evidence for non-pharmacological interventions. So these are really two efforts that lead to improving the quality of non-pharmacological interventions and the access to information about that. And with regards to the subjective cognitive decline PIA, that PIA was, well, actually one of the research was always the main focus of the PIA. So the PIA formed and immediately worked on position papers, but in the PIA, a lot of researchers are getting connected throughout the PIA and also share data. We have quite a lot of publications coming out from the PIA where people used data sets across countries. So that is really very much a research-focused PIA, and I think that's, yeah, in both cases, the PIA is really helping to propel the research and the research quality and connecting people.
That's really interesting to see, because you have two different PIA, and the level of organization and development is quite different between both. Mm-hmm. So it shows really that according to the group of people who gather and according to the topic, you have really different kind of discussions inside. So it's really great.
Yeah.
So how could early career researchers join your PIA?
Well, they can join the PIA, of course, but if they want to be actively involved, we always are very keen on having young people involved in the PIA. And here I can really recommend people to reach out. For example, last year we had one of the junior presenters in our PIA reach out and say, hey, can I get involved? And now she's a student representative in our PIA. So I think that really works. So we have 2 student representatives in our PIA. And what I like is that they come up with the creative ideas on how to involve people in our PIA. So this year we have, for example, a student award, and with the subjective cognitive decline PIA, we had a dinner organized last year, and also drinks after PIA Day, really to connect people. And yeah, I think it's one thing to be involved in the PIA, which I think a lot of PIAs are really happy if someone reaches out and says, I'd like to be involved. I don't know about you, but I'm always very happy when I hear people say that. But it's also a way to connect to other young researchers. And from my own experience, as a young researcher, it was actually during my first AIC, I went to a PIA meeting, and because AIC is such a big conference, it was really nice to meet some people that were involved in the same field of research that I was. So I think it's really a way to find your...
and it's a good way to find your independence as a researcher.
Yeah, exactly. Yeah.
And what are your plans in the two different PIA for the next year? Do you have some very specific goals?
I think we have some specific goals for this AIC. So here we have a scientific session which will be available as a pre-recording, but we'll also have our PIA chat, and on PIA Day we'll have a live Q&A session. And also then we'll have the announcement of our student award winner. So that will be very exciting. That will be August 12th at 8 a.m. Central Time. And for the SCD-PIA, we will also have a live panel discussion on August 5th, 8 a.m. And for the coming year, the very specific plans, I think what we will do this year again is to continue on our cross-PIA collaborations. So for the non-pharmacological interventions PIA and for the subjective cognitive decline PIA, we've hosted webinars together with the diversity PIA. And in both cases, that was a big success. So for the SCD PIA, we also have a featured research session focused on SCD and diversity issues. For the non-pharmacological interventions PIA, we'd also like to organize a featured research session for next year. And we plan to have some open membership calls where people can join the calls on our committee. And we've started some webinar series, of which the diversity was the first one, and we'll continue that probably as long as we're still stuck at home. Webinars are suddenly a very attractive means to an end.
Wow, that's amazing, an amazing program. Well, thank you so much, Sietske. It was really great to talk to you. It is time to end today's podcast recording, but before we go, I do have a final question for you. What advice would you give to any aspiring scientists out there who are thinking of looking into dementia?
Yeah, I found this the most difficult question ever. But what I would advise, and this is, I can only advise something on which how I personally work, and that is to reach out to people, because I think the dementia research field is a very friendly research field, and people are very keen on helping each other and really working together on this big problem that we all really want to solve. So I would say, if you want to know things and learn things, reach out to people and connect with them. And that is because I think that you do science together, and together we can solve this.
Great. Thank you so much, Sietske, for taking time to join us today. Goodbye.
Thank you so much for listening. You can find details and profiles on today's panellists and information on how to become involved in ISTAART on our website at dementiaresearcher.nihr.ac.uk and also at alts.org/ISTAART. We'll be back tomorrow with the next recording in our ISTAART PIA Relay podcast series. Finally, please remember to subscribe, like and review our podcast on iTunes, Spotify and all the other places where you find your podcasts. Thank you.